I saw a friend who got Botox and her eyebrows looked weirdly peaked and pointy, like a villain in a movie. She was mortified. What causes that Spock brow look, and how does a skilled injector prevent it from happening? Spock brow, also called Mephisto brow, is one of the most recognizable Botox complications, and it results from a specific pattern of incomplete frontalis treatment. Understanding the anatomy explains exactly why it happens and how to prevent it. The frontalis muscle lifts the entire brow. It has no bony insertion superiorly. It blends into the galea aponeurotica, the fibrous sheet covering the skull. When you inject the central and medial frontalis but leave the lateral fibers untreated, the lateral portion continues contracting unopposed. The result, the medial brow drops slightly because its elevator is weakened, while the lateral brow shoots upward because its elevator is the only one still active. This creates the exaggerated peaked arch that looks dramatic, unnatural, and distinctly wrong. At DermMavenMD, I prevent Spock brow by extending my injection pattern laterally. Most template-based injectors place 4 to 5 points across the mid-forehead and stop. I evaluate each patient's lateral frontalis activity specifically and add 1 to 2 points at the lateral forehead when needed to balance the brow. The correction, if it does occur, is simple. A small dose of 2 to 4 units placed into the lateral frontalis above the brow peak will relax the overactive fibers and drop the arch back to a natural position. This fix takes effect within 5 to 7 days. The key variable is pre-treatment assessment. Patients with naturally arched brows or strong lateral frontalis activity are at higher risk. I identify these patients during animation assessment and adjust my injection map before the first needle touches skin. At our Madera clinic, Spock brow is a preventable complication, not an inevitable one. It reflects whether the injector evaluated your specific anatomy or simply followed a generic diagram. DermMavenMD does not use cookie cutter protocols because your face is not a cookie.